Hello everyone, my name is Nareda McCauley-Brewstead. Some of my patients call me Cookie. I am a seasoned licensed practical nurse and a certified clinical research coordinator for Mercer Cardiology at Jefferson Health. I have with me today Linda Bartleson, a certified registered nurse practitioner. We are here as members of the Newtown Business Association, the all-around town program. I'm sure we're here to talk to you today about how to listen to your body with respect to what it tells you. I'm sure you will all agree today that we have a lot of stress, a lot of anxiety, which can lead to heart disease and stroke. Why is this happening? We have a pandemic, a COVID virus, who constantly looks for a host to hang on to. We are experiencing the election of all elections. We are experiencing a lot of disagreements among people of all types and all over our nation. We are here today to speak to you how all of these stressors, all of these triggers affect your body. The fact that it can hurt you, it can lead to stress, and which can kill you. And it is so important for you to listen to that body and the signs and symptoms of what it is telling you, that something is going on. It's like the engine of a car. And your heart goes pitter patter, pitter patter, pitter patter. And one day, just like the engine of a car, if you don't take care of it, it will fail you. And now with me, I'd like to introduce all of you to Linda Bartleson, our nurse practitioner. She is a high energy, experienced lady, and you will just love her. Linda?
Good morning, everyone. I'm Linda Bartleson. Thank you, Cookie. I'm here to talk to you today about the signs and symptoms of coronary heart disease. But before we can talk about that, we need to talk about an overview of what coronary artery disease is. The heart disease is the #1 cause of death in the United States. 720,000 people in the U.S. experience heart disease yearly. Okay. A heart attack is a lack of oxygen going to the heart muscle. It's caused by cholesterol buildup or a sudden inflammation and a sudden abrupt clot can form at the site of plaque or cholesterol. It's diagnosed by a physical examination, by lab work, by an EKG, and by the symptoms that you share with us. Time is muscle. That is something that we say in cardiology when we're talking about heart disease. The heart is a muscle. It requires 24-hour-a-day blood flow. If it's not getting it, in a majority of people with coronary disease, it will give you a symptom. If those symptoms are allowed to persist, damage can occur to the heart muscle and cause a heart attack. If you have those symptoms and they're temporary, they go away when you rest, that's something called angina. And what do I mean by this? Angina an example of angina, you go up the steps. At the top of the steps, you're having chest discomfort or a pressure or something doesn't feel right. You sit down and rest and it goes away. That's temporary. That's a temporary decreased blood flow to the heart muscle. That's called angina. If you go up those same steps and you have symptoms and it's persistent and it's not going away with rest, that could be a sign that you're having a heart attack. And that would require you to seek medical attention immediately. Okay. When we are talking about who could be a candidate for coronary disease, who are we looking at? Well, we're looking at people with various risk factors. And there are 2 types. Risk factors that are modifiable, things that we can change, and risk factors that are non-modifiable, things that we can't change. Those things are age, gender, family history, and race and ethnicity. Now let's talk about these. We're looking at the average male, age 55, the average female, age 65, who are having those symptoms. This could be coronary disease. Most heart attacks occur in males compared to females, but at the age of 65 for a female or postmenopausal, your risk as a female is the same as that of a male. Family history is a strong indicator of a personal risk for heart disease. Your mother, your father, brother, sisters, have had a heart attack at the age of 50, 60. You could have those same genetic predispositions to have a heart attack as well. And then race and ethnicity. We know from research that African Americans and people of Asian descent have an increased risk of diabetes and hypertension. That increases your risk of a heart attack. Therefore, we know that people of those descents are at increased risk for a heart attack. Non-modifiable risk factors, or modifiable risk factors, include high cholesterol. Every adult should know what their cholesterol numbers are. Their total cholesterol, their triglycerides, their good cholesterol, also known as an HDL, and their bad cholesterol, their LDL. Low HDLs are an independent risk factor for heart disease. A male should have an HDL over 40, females should have an HDL over 50. High blood pressure. In the average person with no other medical problems, your blood pressure should be averaging 140 over 80 or less. The problem with high blood pressure is we don't know we have high blood pressure because there are no symptoms until your blood pressure is persistently very elevated. So having a yearly physical is very important to know where your blood pressure is averaging, or checking your blood pressure at home, very important. Physical inactivity. What do I mean by this? Not exercising on a regular basis or being inactive. The average person should try to exercise 30 minutes per day. Obesity, diabetes, and I'm talking about diabetes type 2, the acquired type of diabetes. The American Diabetes Association has put out a statement saying that heart disease and diabetes go hand in hand. If you have diabetes, you have heart disease until proven otherwise. And cigarette smoking. Smoking increases your risk of a heart attack by 50% compared to a non-smoker. So symptoms of heart disease, what are we talking about? We're talking about a discomfort that occurs primarily when you exert yourself and goes away at rest. We're talking about chest pressure, chest heaviness, indigestion. It can pretty much be anything from the waist up. I've seen people with jaw pain. They'll go to the dentist thinking that they're having a tooth problem and it ends up being angina. Elbow discomfort, arm discomfort. Something that occurs, you exert yourself, you're having a symptom. If you're having it at rest, you're going to have it when you exert yourself. If it doesn't go away in a brief period of time, we'll discuss what we need to do about that in just a moment. Shortness of breath, feeling like you just can't get enough air. You're short of breath when you go up the steps, and you weren't short of breath yesterday when you did that. Sweating, you break out into a sweat, a full body sweat. Nausea, feeling like acid reflux, feeling like the flu. Extreme fatigue and tiredness. You're feeling lightheaded or feeling like you might pass out. 25% of the population have no symptoms whatsoever, and they're your folks who have diabetes. So what do I do if I experience these symptoms? Sit down and rest. If it doesn't go away in 2 to 3 minutes, you seek medical attention immediately. I recommend that you call 911 and seek professional care through your ambulance provider. Do not drive yourself to the emergency room. Do not have a friend, a neighbor, a coworker take you to the emergency room. And the reason for this is that you can have a progression of a problem. If you're having a heart attack, you can have something else happen and no one's there to help you because the only other person with you is driving the car. So call 911 to seek medical attention. If you're not allergic to aspirin, it would be very prudent to take 4 baby aspirin and chew them at the time of an event. If it did occur and goes away with rest, talk to your healthcare provider, schedule an appointment promptly. Don't wait for your 3-month appointment. So I have high blood pressure. What can I do to help myself? Well, the first thing you can do is follow a healthy diet. A diet that's low in sodium, less than 3,000 milligrams in a day. This is hard. A lot of us don't realize that we're eating foods that are high in sodium. Reading the labels is very important. Regular exercise. Exercising for a good 30 minutes per day. Aerobic exercise. Something that's going to get your heart rate up. Maintain a healthy weight. Manage stress. Limit alcohol. 1 or 2 drinks per week, that's okay. Drinking on a daily basis or drinking more than that can lead to high blood pressure and other medical problems. Avoid smoking. As I said, smoking increases your risk of a heart attack by 50%. I have high cholesterol, so what can I do about that? Well, use olive oil. Olive oil is very healthy for you. It's one of our good fats. We minimize our saturated fats in our diet. Stay away from foods that are in a can, bag, or box. Processed foods, packaged foods, baked goods, high-fat dairy products are all loaded with the bad types of fats. Fats that are solid at room temperature are not good for you. Things like margarine, things like butter, not good for us. Reduce your red meat consumption to once per week. Try to eat lean meats, fish, chicken. So what do I do if I have diabetes? How can I help myself? Well, eat carbohydrates that are healthy. Increase your fiber intake, decrease your sugar intake. Read your labels. Very important. Lose weight. Exercise. That 30 minutes of exercise daily is very important. Aerobic exercise. Exercise plus a 7% weight loss can reduce your risk of a cardiac event by 50%. Very important. What do I do if I already have heart disease? Well, it's never too late to make healthy choices. If you have limitations in exercise, focus on what you can do. Watch your diet, lower your fat content. And there are some exercises that you can do that do not involve walking on a treadmill. You can swim, basketball, riding a stationary bike. All are very helpful. Every little bit helps. So I have high blood pressure, high cholesterol, diabetes, and heart disease. What can I do to help myself? Well, healthy eating, exercise, everything we've talked about. Achieve and maintain a healthy weight. Very important. Don't smoke. Avoid alcohol to excess. And stress management. So, stress as a risk factor for heart disease. Stress is normal. We all have stress. It's how we handle it that's important. If you have persistent stress, that increases cortisol levels in our body. That increase in cortisol level increases our triglycerides and our blood sugar. That leads to plaque development. Plaque is cholesterol in the arteries, which leads to coronary artery disease. Stress can also cause inflammation in the body. That inflammation can cause cholesterol to rupture and a sudden heart attack can occur. Chronic stress leads us to doing things that are not healthy for our body. We eat because we're stressed. We don't sleep well. We don't exercise. We don't make good, healthy choices for ourselves. So what can we do about that? Well, you can give yourself 30 minutes per day. No one else is going to give it to you. You need to give it to you. You need to give yourself permission to take a 30-minute break from TV, from computers, from our telephone. Very important. We need to listen to our body. We need to stop watching the news all day long. It's not going to change from morning to night. Right now, we have a lot of things that are happening in our world that's causing stress. We've got a pandemic. We've got politics. We've got violence. People don't treat each other very nicely, and we're seeing that on the news every day. We need to love ourselves. We need to love our neighbors. We need to find a way to decrease our stress. Try yoga or some exercises. Find a new hobby, something that you can do during this pandemic. How do we prevent ourselves from having coronary artery disease? We need to choose good nutrition. Stay away from sweets, sugars, and soda. Exercise daily. Avoid tobacco products and manage your diabetes. You also need to be a role model for your children. Many of you are home and you're homeschooling. You need to be a role model for them. You need to teach them how to lower their stress. You need to show them the appropriate foods to eat. You need to not buy soda. That's important. These same risk factors for coronary disease can also lead to stroke. What we know is that stroke is a disease that affects the arteries of the brain. So not the arteries to the heart, but affects the arteries to the brain. And a stroke can occur when there's not enough blood flow to the heart or to the brain. Oxygen is blocked by a clot or by a sudden rupture in a blood vessel. This can lead to death of the brain tissue, and time is of the essence. We know statistics for a stroke. One stroke occurs every 40 seconds. It's the 5th leading cause of death in the United States. There are 2 types of stroke. One that's caused by bleeding in the brain, which usually occurs in about 13% of the strokes, but the majority of the strokes are related to cholesterol or clot forming in the arteries to the brain. The risk factors are the same. Symptoms of a stroke could be one-sided weakness, slurred speech, facial droop, suddenly pass out. If you see any of those symptoms occurring to a friend, a neighbor, or to yourself, you need to seek medical attention immediately by calling 911 and telling the operator that you think someone's having a stroke, because time, again, is very important. Time is muscle of the brain, very important. They can give medicines such as clot-busting medicines in the emergency room. There are lots of things we can do that can help prevent you from having long-term effects of stroke. COVID-19. Right now, we are in the middle of a pandemic. It's very important that we listen to our CDC guidelines about how to prevent you from being exposed to COVID-19 and preventing the spread of this virus. There's no cure. There's no true treatment that works right now. The only thing that we can do, which is very effective in preventing the spread of this disease, is to wear a mask. Buy a mask, wear it. You need to be wearing it at all times when you're in public or at work, at home when you're with multiple people. Wash your hands. We need to wash our hands when we're coming in the house, when we're going out of the house, when we touch money. We need to wash our hands frequently, and we need to social distance. These are the only things that are going to prevent the spread of this disease at the present time. If you have any questions or feel you have symptoms that you want to explore, give our office a call. We're Mercer Bucks Cardiology. We're right here in Newtown on Pheasant Run. And we would be happy to meet with you and discuss any of this. Thank you. We also have websites. We also have a website, mercerbuckscardiology.com, which gives you a lot of information that may be helpful to keep you healthy. We also recommend heart.org, cardiosmart.org, the Mayo Clinic, or WebMD as sources for information that may be relevant to you. Thank you.
Linda, I want to thank you so much for such an informative presentation.
You're welcome.
And I also want to thank the Newtown Business Association, the All Around Town program, for giving us this opportunity to bring to you such a life-saving message. And please, feel free to go online and look up the Newtown Business Association and find out about the multiple activities that they have going on throughout the year, their All Around Town program. I also want to ask you to please look up mercerbuckscardiology.com. It will tell you about the multiple services that we offer. We have great cardiologists and great electrophysiologists also. Thank you very much, and have a safe weekend, week, whatever it is that you're doing with COVID. Please get in your cars, take a ride, do something, okay? Thank you very much.